we'll be discussing the surgical coordinator process. My name is Mackenzie.
I'm Elizabeth.
I'm Elena.
And we're members of the surgical scheduling team. Here with Milan Eye Center, we wanted to discuss our role in patient care and what you can anticipate during your surgical scheduling appointment with one of our team members. So this appointment would take place after you go through the testing process and have your initial evaluation with your surgeon. If your surgeon recommends that you move forward with surgery, the next step is to set up your surgical scheduling appointment with one of our team members here. Just to give you a brief overview of what to expect during the appointment, you can anticipate that it will last around 45 minutes depending on the procedure type, as well as any questions that you may have. In the appointment, we'll discuss any remaining questions you have after meeting with the physician. We'll review your insurance benefits and anticipated out-of-pocket associated with your procedure. If you were recommended for cataract surgery or refractive lens exchange, we'll review your lens options. We'll schedule your surgical dates and postoperative care. We'll sign your consents for your surgery, and we'll review any pre- and postoperative guidelines, including limitations and restrictions, as well as medications that you'll need after surgery is completed. To prepare for your surgical scheduling appointment, you will often get at least an idea from your surgeon as far as the days that they're operating and locations. So if you can look at your calendar ahead of time and keep in mind the days, give some date options. Also be aware that you will likely need a driver to stay on site with you throughout the surgery. So get in touch with someone that may be able to drive you, get their timeframes in mind, and have some date options when you're arriving to the appointment to be well prepared. Beyond this, have your calendar with you, any travel plans or any events that you have coming up in the next few months as well. And with that, we'll pass it over to Elizabeth.
All right, so when you first come in for your appointment for surgical scheduling, we will go ahead and address any additional questions that the patient may have. First and foremost, going over kind of how good their evaluation is and how long they have to kind of get their surgery scheduled. We'll go over the different lens options that the physician has recommended for you based on your lifestyle as well as the health of your eye. We will go over how long can they wait to have this done in terms of how far progressed is their cataract, and then we will go over the lens options. So addressing their lens options as well as discussing their financial obligations when it comes to those options will be discussed during the financial portion of the preoperative scheduling appointment. With that, I'll throw it over to Elena so she can go over the financial aspect of your surgical scheduling appointment.
So we have an insurance verification team that are verifying benefits for each patient that scheduled their preoperative appointment based on their procedure. The out-of-pocket amount is calculated for 3 components: professional, facility, and anesthesia. So we will give you the total estimate out-of-pocket for procedure that you are recommended. Some procedures and some insurances require pre-certification, meaning that we would need to submit requests for insurance to review everything and approve procedure. And this cannot be done ahead of time. When we submit for approval, we have to indicate when and where the surgery would be done. So please don't get upset if we schedule your procedure further out. We may not be able to do it next week or in 2 weeks because pre-certification may take up to 14 business days depending on insurance. During the preoperative appointment, if you're doing the cataract surgery, we will schedule a total of 6 appointments for you. We'll schedule 2 surgeries, 1 per eye, usually 2 weeks apart minimum. If you need further out, it can be done 3 weeks and 4 weeks out, but most people schedule it 2 weeks apart. We also will schedule for you 1 day and 1 week follow-up appointment after each surgery for you to come see one of our optometrists or one of the optometrists who referred you to Milan Eye Center for the surgery. During these appointments, doctors will take a look at your eye, make sure everything looks good, eye heals nicely, your vision improves, your eye pressure stays in normal range. After 1 day and 1 week appointment, they may see you in 3 to 5 weeks. So we usually call it 1 month's appointment. During that appointment, they may discuss with you any glasses options that you may end up with after surgery, depending on the lens choice that you had. With that, Mackenzie has some other points to cover.
All right. So after scheduling, as Elena mentioned, both the surgeries as well as postoperative care, we will move on into signing consents. So in light of trying to make this comprehensive and all prepared version of your appointment and make it everything smooth on surgery day, we'll sign your surgical consents, all your insurance related consents. If you're moving forward with cataract surgery, we'll sign the lens option specific consents. HIPAA release forms, so who we can disclose information about your surgery to on the day of surgery, and sign the consents for anesthesia as well. Just making sure, again, that we're well prepared for day of surgery.
Now, once we have gone over and scheduled all of your appointments, we will go over both your pre and postoperative guidelines, as well as limitations and restrictions, and what kind of medications will be required for after surgery. We do have several options available to us here at Milan Eye Center in terms of eye drops, either through us or through your standard pharmacy. We will go over how you will be implementing in those eye drops over the course of several weeks, both before and after your procedure. Once we've discussed your eye drops, we will go ahead and review your medications, allergies, and what to bring with you the day of surgery, as well as when to discontinue contact lens wear. After that, we will go ahead and review your postoperative instructions. We do ask patients to please refrain from any type of heavy lifting, strenuous exercise, and bending at the waist for a minimum of 2 weeks after their procedure as their lens settles and heals into place. We do also ask that patients please plan their surgeries accordingly, as there are restrictions in terms of no eye makeup for a minimum of a week and no swimming for 4 to 6 weeks. This mostly affects our patients in terms of vacation and travel plans. Patients are allowed to go ahead and fly as soon as 1 day after surgery, depending on how their eye is healing, and those that are considered higher risk may be given additional instructions prior to scheduling their surgeries as to kind of how to coordinate their vacation and travel plans. Once we've gone over everything, we will give you a goodie bag before you leave the day. We will give you a pair of dark glasses to help with light sensitivity after your procedure, as well as surgical tape. The surgical tape will be used to type on an eye shield that will be given to you on the day of your procedure to wear at night for the first week after surgery to prevent you from bumping and rubbing your eye. Now, before patients leave the day of their surgical scheduling appointment, we will give you our business card, as well as instructions that we will contact you 2 to 3 days before your procedure to go ahead and either collect payment and review your fasting instructions with you the day of your procedure, as well as making sure that you have arranged for a driver to come with you. If you have any additional questions, Milan Eye Center and the surgery coordinating staff is always available to go ahead and answer any questions that you might have prior to your procedure and re-review any of the information that you've been given. With that, thank you so much for joining us today, and I'll throw it to Mackenzie to close us off.
All right. So again, the goal of the appointment is just to ensure patient preparedness on day of surgery and an efficient surgical process on the day of as well. Thanks for taking the time to watch this video. If you have any additional questions or things that you'd like us to cover in future videos, comment below, and we'll definitely take that into consideration for future content. We appreciate you and have a good day.